Hey, good morning. So today we're going to talk about gout. Acute gouty arthritis is classically shown presented by the patient by excruciating joint pain, redness, and warmth around the joint. The most common areas that you'll see a patient present are the great toe on either foot, moving up to the ankle, instep, and up to the knee. It can also be in the upper joints, but the lower extremities are the most common cases. The pathophysiology behind gout is hyperuricemia. This can be caused from an overproduction of uric acid or the inability of your body to excrete the extra uric acid that you have. Overproduction is the cause in 10% of cases. This can be from a deficiency of HGPRT. HGPRT is an enzyme that is used in the purine salvage pathway, and it leads to decreased recycling of the precursors into purine metabolic pathways, and from that causes an increase in uric acid accumulation. The second reason for acute gouty arthritis is reduced renal excretion. This is the cause in 90% of cases, and this is a decrease in the filtration and an under-excretion of uric acid for most cases. Testing and diagnosis of gout include patient presentation. Most times if patients have had a history of gout and they present with excruciating pain in the gold standard, the big toe, with the warmth and the redness, you can diagnose the gout. Other ways to diagnose are ultrasound. You can actually look over the joint and see the detection of the urate crystals or the tophi or tophus around the joint. CAT scans can also be used, but that may be unwarranted radiation to the patient. Joint fluid can be aspirated with a needle, then sent down to microbiology, and they can look under the microscope and actually see the urate crystals. Blood testing can also be done. You can test for an increased serum uric acid or an increased creatinine, although all patients that have this may never develop acute gouty arthritis, but that could be if they present with the pain in the joint, with the redness and the warmth, along with the increased blood test, you could treat them for that. Medications for the acute attacks include corticosteroids such as prednisone. Patients can also have steroids injected into the joint site. NSAIDs such as colchicine, indomethacin, and ibuprofen are also used at the time of the attack to help decrease the inflammation and with the pain that the patient may be experiencing. Prevention of acute gouty flares includes some long-term medications that the patient can take daily and lifestyle changes. The medications given include allopurinol and Uloric, and these block uric acid production. Lifestyle changes are one of the best ways that a patient can reduce their gouty attacks. So patient education is extremely important. Decreasing alcohol intake, decreasing drinks high in fructose, which is a sweetener, decreasing foods high in purine, which include red meat, organ meat, and seafood, and maintaining a healthy body weight and staying hydrated with things like water. Just those alone can prevent the patient from having acute gouty arthritis flares. Thank you.